First and foremost, I just want to welcome everyone. And on behalf of the Orion area, the Clarkston area, and the Auburn Hills Chamber of Commerce, thank you so much for joining us this morning. It is our pleasure to be offering you a webinar, The Science Behind the Vaccine, Once Vaccinated, What's Next? And so I want to first thank Steve Heyer with IGD Solutions for allowing us to use this virtual platform. And just in case you weren't aware, IGD Solutions helps small to medium-sized businesses with their website application. They are happy to help you with custom application programming, and they also help nonprofits as well. So on that note, I am going to welcome our two panelists who have joined us so far, Dr. Gilpin and Dr. Fragoli. They are Chief Medical Officers, and Dr. Fragoli is the Chief Medical Officer for St. Joseph Mercy, and Dr. Gilpin is the Chief Medical Officer for Beaumont, Grosse Pointe, and the System Medical Director for Infection Prevention and Epidemiology for Beaumont Health. And so we thank you both so much for joining us, and let's just jump right in and start with our questions if we can. So the first one is for you, Dr. Fragoli. If you would please start by explaining the differences between the Pfizer, Moderna, and the new Johnson & Johnson vaccine, just a little bit about the pros and cons.
Sure. Good morning, and thank you for having me. So the science behind the three different vaccines, I won't get into details, but I will just say that Moderna and Pfizer are very similar in that they are mRNA-based vaccines. This is a relatively new technology for vaccines, but not new to the science in oncology or in cancer treatment. So it has a great safety profile from what we have seen so far, with millions of people receiving the vaccine internationally, and Johnson & Johnson being the newest kid on the block has a lot of promise as well. Particularly and importantly, it's a single dose vaccine, which is different than Moderna and Pfizer, which are 2 doses. But the technology and the science behind the two types of vaccine is that the Johnson & Johnson uses a weakened virus that is to get into the cell, whereas Pfizer and the Moderna basically use a technology that has a sort of a fatty lipid sort of sphere that allows the cell, the virus, information that's required to make the spike protein to allow that into the cell so that it can produce the necessary antibodies that the vaccine, both vaccines would, or all 3 vaccines would require to provide protection, and so they're both, all 3 of them are excellent vaccines, and all 3 have shown quite a bit of promise.
Okay, thank you for that. You could please explain how the vaccines work.
Sure. And
how many Pfizer and Moderna have, and they've developed and marketed, how many they've been selling, as far as how many years they've worked on them, and then any other mRNA vaccines that we have may already have been aware of prior to COVID.
Sure. Okay. So the mRNA vaccine, I think I described it just very briefly earlier. So the mRNA vaccine is a relatively new technology in the vaccine space. It basically takes a small portion of genetic code that's necessary for the production of antibodies so that your body is able to make antibodies against the virus. It does not contain any sort of virus portions of the virus other than that little small sequence of the actual spike protein, which is the protein that's on the surface of the virus that allows it to interact and connect to our human cells. And so the body is able to produce what are called antibodies against the virus through using the body's own manufacturing process of creating these antibodies. And the vaccine has been in production ever since, I think they started the project in January of last year. As soon as we were able to identify and and begin to the manufacturing process of the new virus, of the new vaccine. So Moderna and Pfizer. Pfizer actually worked with a company called BioNTech, a German company, and they worked to develop this technology. They've been working, I believe, for about 18 months before this with working on a vaccine for the flu. However, they sort of changed sort of process and started to work on the information related to the COVID-19 vaccine. And so they've been working on this for quite some time. They've had a very large multinational trial prior to the approval process with the FDA. So it was not only in the United States, but it was in other parts of the world where they studied the vaccine, not only for efficacy, which means how effective it is, but also for safety. And in that large study group, they were able to identify in relatively short order, in large part because there was just so much prevalence of this virus throughout the world, that they were really able to very quickly move the timeline of getting a vaccine to the market in a period of something like 18 months, which is really less than a year, which is really quite amazing. Most times these vaccines would normally take 2 to 3 years or longer. But given the fact that there was just they were able to recruit so many patients for this vaccine, they were able to get a lot of data available to the FDA in their trials, so that they could test it appropriately for safety and efficacy. And both vaccines are between 94 and 95% efficacious. But what's really important is that they were most efficacious in preventing severe disease. That's really the most important part. There's no guarantee that you won't get the virus if you have the vaccine, but the key is to prevent illness that leads to death and intensive care and hospitalizations, and that's what they were able to demonstrate. And the Johnson & Johnson vaccine, again, very, very similar, although I know that the press has sort of gotten a hold of the fact that it is less efficacious, less than 70%. But quite honestly, when you look at the severity of illness and trying to reduce the likelihood of hospitalizations and patients ending up in the ICU, Johnson & Johnson was very, very effective in doing that, just as effective as Moderna and Pfizer. So as it relates to severe disease and preventing severe disease, all three are very much on the same level playing field. And there's some, I think, pretty good evidence that's mounting related to the new variants that are circulating in our communities, in that the vaccines, I think, will be pretty well posed against preventing severe disease in these patients as well, that may have a variant from the original virus that we saw in the beginning of this pandemic. And then there's another one that has not been approved yet, and that's the AstraZeneca, and that's primarily in other countries. So currently there are only 3 vaccines that are currently approved under the emergency use authorization of the FDA, and those are the 3 vaccines that we just talked about.
Thank you. Okay, and now we're going to move over to considerations for those who have already had COVID. And Dr. Gilpin, I will turn this first question over to you, if I may. So if you have had COVID, how does the vaccine affect you? And then a second question to follow up with that, are you risking getting more sick than someone who has not had COVID? So
the question was, if you've had COVID, well, first of all, should you still get the vaccine? And the answer is yes. Right, when the CDC came out with their guidance here, they really recommended, first of all, we're in a situation where we have relatively limited supplies, right? So if you just had COVID within the last few months, your risk of getting COVID again is very low. It's almost zero. It's probably not exactly zero, but it's pretty low. So the idea was that you would be a lower priority candidate for a vaccine, and we could focus on giving the vaccine to people who are at greater risk. That being said, if we're in a situation where we have ample supply of vaccine, and hopefully we'll get there very soon, I want anybody who can get the vaccine to get the vaccine, regardless of whether you've had COVID or have not had COVID. Now, one thing we've experienced here, and I'm sure my colleagues will probably chime in as well, we have noticed that there is a little bit of a tendency among people who have had COVID, when they get the COVID vaccine, they may have more robust side effects. Now, that's not an absolute. It's not always happening, but it is something to take into consideration. And the idea is pretty simple. If you've had COVID, you probably have some antibodies or some memory immunity in your body. And so when you introduce a vaccine into that environment, you're stirring up your immune system, which is what you want to do, right? You want your immune system to wake up and produce an immune response so that you can have protection. But if you already have some memory immunity on board, it could, I don't want to say overstimulate, but it could make that response a little bit more robust. And we have seen people with a history of COVID have more fatigue, weakness, low-grade fevers and such after getting the vaccine. I don't say this to discourage people from getting the vaccine. I still want people to get it. It's important. And the message that I try to push to folks is that feeling you get after you get the vaccine, that low grade, kind of feel run down for about 24 hours or so. First of all, it's temporary. It will go away. Second of all, it's a good signal, I think, that the vaccine is doing exactly what it's supposed to do. It's triggering an immune response. It's creating antibodies and providing protection so that if you are faced down with the real McCoy at some point in the future, you'll have that protection on board to keep you safe.
Excellent. Thank you. Okay, and this next question is for Dr. Patel. Dr. Patel, welcome. Dr. Patel is our Chief Medical Officer from McLaren Flint. So glad, we apologize for the technical difficulties and are so glad you're able to join us this morning. So my question for you is, if you've already had COVID and recovered, is there any additional benefits to getting the vaccine? And should those who have had COVID consider getting the vaccine differently from those who have not had it?
Sure. Well, thank you for the invitation. And I had to call my daughter, my 9-year-old daughter, to figure out how to get on to this. But I'm on. So thank you to my colleagues that are on here for hopefully answering some of the other questions. But for the question that you just asked, if someone has had COVID and subsequently recovered, what's the benefit of getting the vaccine? And it's important to realize that COVID has only been around for about a year, a little over a year. And so we're still trying to understand what we call passive immunity from having had COVID. And what we're seeing is a full range. Some people have mild immunity to others that may have pretty significant immunity. Having said that, because there's such a wide range, recommendations now are that once you have recovered from COVID, that you should really seek the vaccine when it is your turn, in terms of the phases of when you're eligible. So there is a recommendation to go ahead and get the vaccine, even if you've had COVID, to sort of ensure that your immunity is fully appreciated. The second question, is there anything to consider differently? Not really. I think Dr. Gilpin just sort of mentioned that if you have had COVID and you get the vaccine, you might experience a more robust side effect, but nothing that we've seen here within our health system that couldn't be addressed pretty easily with just some over-the-counter medications. So, you know, typically these are very short-lived, 1 to 2 days, and you're fully recovered after that. So.
Okay,
Gene,
thank you. Yeah.
Gene, sorry, if I could chime in on that real quick. One thing I want to mention that's kind of interesting about this vaccine and this disease in general is ordinarily we think about immunity from an infection as stronger immunity, better immunity. Like, for example, if you get hepatitis B the old-fashioned way, you'll have a much more robust immune response and it will last much longer than if you get the hepatitis B vaccine, for instance. COVID actually, particularly with these newer vaccines, these mRNA vaccines, actually seems to be the other way around. The immunity that you get from the COVID vaccine actually seems to be more robust, stronger than the immunity that you get from having the infection the old-fashioned way. Now, that's not an absolute, and we still, as Dr. Patel pointed out, we still have a lot to learn in this space, but that's a curious observation, and I think it's a good reason why we should be encouraging people to get the vaccine, even if they've had COVID, because the protection may end up lasting longer and it may be better protection.
Such a good point. So I think one of the questions someone might ask would be, so is that true for all of the vaccines? Does that make a difference, so to speak? You know, is it with Moderna and Pfizer having a higher efficacy, I guess, and then versus the Johnson & Johnson, is it holding true for both?
It seems to be, yes. Now I can say we know a little bit more about Pfizer and Mrna because they've been around for a little bit longer. We've had a little more time with them. It will probably hold true with other vaccines as well, but to be continued.
Okay, very good. All right, I'm going to move on then to some of our general vaccination questions that we received from some of our attendees. So once vaccinated, what are the recommendations for staying safe? And Dr. Patel, I'm going to
Sure.
to your questions first here. I know you just recently answered, Dr. Fergoli. We'll get to yours in just a quick second here. But if I can split this up, that would be great. So I know that this varies wildly, so we'd welcome your feedback.
Sure. So at this time, since there is still a bit of uncertainty around how the virus is transmitted, the guidelines are still that that you want to practice safe. You want to still have safe practices, mask wearing, hand washing, social distancing, all of that. Now, some new guidelines came out this week that are very encouraging. That if you have been vaccinated and you've gone beyond that 2-week time frame from your second dose, if you're getting the 2-dose vaccine, that you can be in a household with others that either have not been vaccinated or have been vaccinated and not wear a mask potentially. Having said that, when you're out in the public, I think it's still important to keep these guidelines in place until we get more information on how we can move forward, or hopefully when we reach that point where we can consider ourselves at herd immunity. So that would be my recommendations based on what I've seen with the CDC and just within what we've seen in other countries as well.
Okay, very helpful. And I think you've really addressed the next question. I'll just throw it out here anyway, if you can. Can you still catch COVID-19 and infect others? I think that's one of everyone's main questions.
Yes, unfortunately, that is at this point what we're thinking is that just because you've been vaccinated doesn't mean that you may not catch COVID. But I want to again emphasize, and Dr. Gilpin has mentioned this already, that you're very unlikely to have to be hospitalized, or even in worst case, the worst possible cases of death. The mortality rates are essentially near zero with those that are vaccinated, and we have strong numbers that we can see around the world as more and more people get vaccinated. A lot of good data coming out of Israel, for instance, that is showing what the effects of vaccination and how safe it is, and what the vaccines have been able to do. So a lot of good work that's been done, and we can tap into that to use that for our guidelines here.
Okay, thank you. Dr. Fergoli, I'm going to pose the questions regarding mutation to you next. And so if you first could explain the frequency of occurrences of spontaneous mutations that can develop into a new strain of the virus, and then follow that up with, does the different type of vaccine, 1 versus 2 doses, make a difference in whether you'll need a yearly follow-up if necessary? And does the vaccine work against mutations? And I know that this probably varies and maybe a little TBD here, but welcome your feedback.
Sure, thank you. So first and foremost, the natural history of any virus is to survive, right? And this is the way it knows to survive. It knows, I'll put in air quotes, but is, the intent is for it to continue. And the only way to prevent mutations or to reduce the number of mutations is to reduce the number of infections that occur. So the more we can contain the spread, that is probably our very best solution to reducing the number of new variants that are entered into our population. So one way to do that is obviously by reducing or by using things like physical distancing, masks, good hand hygiene, reducing high-risk activities, large groups, et cetera, that I think everyone's very familiar with. But right now, in today's, what we have in our current armamentarium of solutions is the vaccine. So being vaccinated is one of the best ways of reducing the number of variants that are available. We know that there are many variants available, 3 or 4 that are now just sort of surfacing that are present in the United States. Some states obviously have all the variants that are of concern with COVID-19, and it will continue to see new variants. And I think having both, if you've received either Mrna or Pfizer, making certain that you've received both vaccines, I think, is very important to reduce, as I described earlier, by reducing the number of infections that circulate. But if you happen to have Johnson & Johnson, which is a single dose, both of those, all 3 of those vaccines and any future vaccines will help reduce the number of variants. As far as I know that Pfizer has, or actually I think Mrna has begun work on boosters, so that when new variants come into the environment, one of the advantages of mRNA vaccine, which is Pfizer and Mrna, is that it is very scalable, so that they can take that small spike protein that maybe has changed a bit, the code, and then very quickly and very easily send it to the manufacturing process much more quickly, as opposed to vaccines like Johnson & Johnson and others that use attenuated viruses, which are either killed or dead or whatever, viruses that need to be used in the process of creating the vaccine. That could take a lot longer, right? Because they have to harvest the vaccine, they have to grow it, culture it. And so one of the advantages of the mRNA technology, which I think will probably revolutionize the vaccine business, is to help with the ability to scale and quickly get new new variants built into the new vaccine, or boosters that may be necessary on an annual basis, depending on what is currently circulating in the population. As it stands today, the 3 vaccines that are available seem to provide really good protection against the variants that are circulating, including the South African variant, South American variant, sorry. And so I think what we are looking for is, ongoing, using the technologies that we have to best protect our population, and that's through vaccine and prevention of infection. Those are the two, I think, most important things that we can do as citizens to help protect each other.
Excellent. Okay, and Dr. Gilpin, I am going to jump over to you now. We've had some of the questions have been answered, so I'm going to just give you a couple together that were broken up in our list. So I think a main question is, once I get the vaccine, if I get sick, how do I know if I actually have COVID or I'm just having side effects? And then following up from that, will the vaccine be like a yearly flu vaccine? You know, how often do I have to get it? And or how long will the vaccine work once I receive it? So I'll turn it over to you.
These are good, really good questions. So the first question was, how do I know if, so I got the vaccine, how do I know if this is just side effects or if I've got actual COVID?
Mm-hmm.
I think the best answer I can give you is a pretty clear line between when the side effects occur after getting vaccinated. If you get your COVID vaccine today, the side effects will probably begin tomorrow and they will probably last 24 hours. And those side effects are most commonly soreness in your arm, low-grade fevers, you know, maybe 100 point something. You'll feel run down and tired, and that should completely run its course within 24 hours. We're not seeing a lot of people have side effects like cough or upper respiratory symptoms or gastrointestinal symptoms after getting the vaccine. So any of those symptoms, as far as I'm concerned, are red flags. If you've got the aches and the chills and the low-grade fevers and it kind of goes away after 24 hours, probably side effects. So you got to do a little bit of your own kind of home detective work on this. I think it's in your best interest if you do have symptoms to make sure you're wearing your mask and physical distancing and do all the things. And if those symptoms persist beyond a day or so, then yes, you should absolutely get checked out. And I hope I answered that question. Excuse me. The second question was about how long do we think this vaccine immunity is going to last? Is that right, Jean?
Correct.
Well, this is the unfortunate side effect of doing this manufacturing process and these studies in relatively rapid succession is that we just don't have a lot of long-term data, unfortunately. That being said, I've heard both the Pfizer and Mrna manufacturers in statements say that they expect vaccine immunity to last for at least a year and potentially longer than that. Short answer, I think we're just going to have to watch this thing and figure out what comes next. I would not be surprised because, you know, as Dr. Fragoli pointed out, we know this virus will mutate. It's not unique to this virus. If given the opportunity, it will continue to mutate. So I would not be surprised if later this year, if we haven't reached that critical herd immunity threshold that you hear us all talk about, it's very possible that they may repackage another vaccine as a booster that includes some of these strains like the South African variant, the Brazilian variant, the UK variant, just as insurance to make sure that people have that protection on board. I would not be surprised if that happens. But stay tuned.
That makes sense. Okay, I am now going to jump over to Dr. Patel, if I may, and I'm going to ask you, you know, do you believe that we'll have the option to choose at some point, and or is this where you should take what you can get when you can get an appointment? And then going back to something Dr. Gilpin mentioned as far as the booster, I think one of the questions was how often might that happen? And I know we said, you know, annually, but is there a possibility based on mutations? Everyone's curious if it would be something that would have to happen sooner rather than later. So thoughts on those topics?
So let me answer the second part first, because I think Dr. Gilpin has already sort of answered that. It'll take time for us to understand how the variants are progressing forward, and the longer it takes for us to hit herd immunity, the greater the chance that we will have more variants, which will then lead to the potential that we will need a booster. So that's my segue into get what you can as soon as you can, to answer the first question, because the goal is to get to herd immunity. And there's enough information out there to show that any of the three that we currently have, any of the three vaccines are effective in preventing hospitalizations and preventing death. I think that there's been too much coverage around the numbers related to the efficacy and less around what the vaccines are actually doing in terms of prevention. And I think if we focus more on that and understand that if you get any one of these three vaccines, you are limiting your chance of being hospitalized and limiting your chance of death. That is the ultimate goal. And then the community ultimate goal is to get to that herd immunity. And if we get to that, the variants go down, or there's less of a chance of variants, and then potentially less of a chance that we will need a booster. So sort of combines the two answers together. And I mean, just my my plug to say, when it's your turn, get out there, get your vaccine. It really doesn't matter which one you get. The nice thing, and it may have been mentioned earlier, the nice thing about the Johnson & Johnson is that it is only one shot. And so you get the one shot and you go on with your life. You don't have to schedule a second dose 3 weeks or 4 weeks later. And then the other thing that we're going to start to see is that more and more, there's going to be more and more access sites available for getting the Johnson & Johnson, all the way down to just, your doctor's offices are going to be able to get Johnson & Johnson. That's been the challenge with Pfizer and Mrna, because of the way that the vaccine has to be stored, that the access sites have been limited. But this is wonderful news that the Johnson & Johnson does not have the same constraints. And so it's just more readily available. And again, you won't have to worry about that number if you get to herd immunity.
Okay, wonderful. Thank you. Okay, Dr. Feroli, I'm going to turn this one over to you actually. And we're going to talk a little bit. We've had a number of questions that have come through on the Q&A. And so I'm just going to lump some of these together. One specifically, are they giving it to pregnant women? If so, are there known side effects, potential risk for future childbearing? And then another question is, when do they anticipate a vaccine will be approved for distribution in children? And then another one is specifically talking about how diverse were the trials. So as we've learned about Black and African-American communities have been hit harder than any other community with COVID-19. How can we be sure that the vaccine works as effectively to particular communities? So just some easy questions right there. And you're muted, sorry.
No, those are really very good questions. So the first question was, I believe, around pregnancy. So the best advice that we can give, first of all, based on the studies, the studies have not included, particularly Pfizer has not included any pregnant women in their trial, right? So that was the intent, was to, in order to get to a rapid point of decision whether or not there's safety and efficacy, pregnant women were excluded from the original trial. However, having said that, the trial was quite large and women got pregnant during that time. And during the study period, there were no untoward, in the sense of abortions that were expected. These would be spontaneous abortions or miscarriages, as they're commonly known as, that occurred as a result in that particular study group, even though they were not looking at that. So the American College of Obstetrics and Gynecology has recommended that first of all, a conversation should occur between the physician and their patients and the patient regarding whether or not would be appropriate for a pregnant woman to receive the vaccine. There is, and when there is no obvious data, and more data is coming, it's just a matter of collecting enough of it and analyzing it. But the important thing to look at is that women who are pregnant and develop COVID, the infection, actually have a poorer outcome than those who. So you look at the risks versus the benefits of getting the vaccine, and there is a bit of an indication to suggest that the vaccine may provide more protection as opposed to not getting it and potentially becoming infected. So that's why it's important to balance the risks and the benefits of the vaccine, and having that conversation with their obstetrician gynecologist to determine if it's appropriate. But more data is coming, and more studies I'm sure will be published, and we'll have a much stronger recommendation once that comes to fruition. The second question is there concern with the vaccine regarding becoming pregnant in the future? Well, we don't have any concrete data one way or the other, but there is no evidence that I'm aware of. And if the panelists have anything that may be brand new that has sort of surfaced in the past few weeks, please chime in. But there is no evidence to support the claim that the vaccine will cause infertility or problems related to that. I know that is a common misconception, but there's just no study or evidence to support that. And then I think the third question you asked, actually you asked about children. So the vaccine, the Pfizer vaccine is licensed, I believe, 16 and over, and Mrna as well as Johnson & Johnson are for 18 years of age and older. So I know that studies are in process right now for for children, but it's not currently licensed or approved for the younger age group. And I think it's very appropriate that they're taking their time to make sure that the safety is there for children. And when that time comes, we're hopeful that a vaccine will be available for them as well. But at this time, under 16 and 18 is not recommended and not approved. And then you asked about diversity. In the trials that at least the information that's been submitted to the FDA for approval under the EUA, the emergency use authorization for all three vaccines, showed great. The studies were very well designed to be balanced and to make sure that they were balanced and supported patients of all ages, walks of life in the sense of their race and ethnicity. And in particular, the African American population was very well served and showed great efficacy, as well as reducing these patients from being with severe disease. So I think the studies were designed intentionally to support that information. So I think that all patients, irrespective of whatever comorbidities, whatever health issues they may have, or their race, ethnicity, they should consider getting the vaccine when it's appropriate, as Dr. Patel and Dr. Gilpin mentioned.
Okay, thank you.
I would, if you don't mind, I would just like to add one additional piece about the pregnancy. A paper just came out either last week or this week, which shows that the antibodies that are created by the body do get passed through the breast milk. And so exactly why one of the best reasons for breastfeeding is the protection that the mother can give to the child. And so so this just again just shows the effectiveness of the vaccine, and just more encouraging information for pregnant or breastfeeding mothers.
Dr. Gilpin's given you a thumbs up. So All
Absolutely.
right, thank you very much, Dr. Patel. Okay, Dr. Gilpin, this next one is for you, or next couple actually, and I'm going to jump around a little, so bear with me, but we've answered a couple of the ones that we had prepared, and then we have so many that have come in through the Q&A. So first of all, one of the things looking long-term, is there any possibility that the COVID vaccination may be part of the regular flu shot at some point, or a combination of vaccinations, so to speak? And then does anyone have any idea or considerations for what the negative long-term effects could potentially be? And then I think our next question, we've got a lot of questions around the office. And so, one of the questions is, if you can still get COVID and spread it to others, would it be wise to still work from home wherever possible versus sitting in an office with hundreds of people? And then how safe might that actually be? And looking at office space and someone receiving the vaccine, should they wait to go back to the office after, if they've been in the office and they get the vaccine, should they stay home and work from home a couple days? Your thoughts?
So the idea of a combination vaccine combining flu and COVID, in the future is a really interesting idea. And I would not be surprised if the data suggests that the COVID vaccine is something that we're going to have to be given more frequently, that 2 doses won't be enough, and that we're going to need a booster at some point. That would certainly be an attractive way to deliver a vaccine to a large group of people, in the simplest way possible. Just to point out here, there is a recommendation that, of course, we still want you to get your flu shot, right? You'll always hear people like me saying, get your flu shot every year, and it's important. And the flu shot has really become cannon fodder, I think, for a lot of people, unfortunately. But I just want to point out that one of the interesting side effects or consequences of this pandemic is our flu numbers are incredibly low this year. I mean, like single digits low. We have never seen a flu season like this. And I want to just highlight that it tells me that this works. And so I'll get to that when we talk about the office type questions. But to answer the combination vaccine question, I think that's a very clever idea. And I wouldn't be surprised if something like that materializes if we do have to continue getting COVID vaccines into the future. Long-term effects of the COVID vaccine, it's a good question. It's an impossible question to answer at this point because I just lack data. But I will give you a little bit of confidence. Of all the vaccines that we are aware of, and there are many. We have hepatitis vaccines, we have measles, mumps, rubella, we have tetanus boosters, we have flu shots. All these vaccines, none of them really carry serious long-term side effects, consequences, right? Most of the side effects of vaccines are short and self-limited, meaning they go away on their own after a period of time. So there's really not a lot of precedent for big, bad long-term side effects or things that will suddenly appear 6 months later after you received a vaccine. That's just not something that we've seen historically, and that's not something we expect to see with the COVID vaccine. As far as transmission after vaccination, this is a very interesting topic, and I can totally nerd out on this all day, but I'm going to keep it short because we got a time limit. So the idea is that when I get the COVID vaccine, I am protected from getting COVID disease. But is it theoretically possible that I could become infected or exposed and carry some of that virus and potentially transmit it to other people? That is theoretically possible, all right? And just to put a finer point on that, that's not a new thing with COVID, right? We've always known about this possibility with other vaccinations, with the flu, for instance. Any respiratory viruses, these are all real possibilities. The one exception, the only exception that I'm really aware of, is the measles vaccine. The measles vaccine provides something that's called sterilizing immunity, which means you get the measles vaccine and you're protected from disease. You're also protected from transmission. It's extremely difficult to get sterilizing immunity from a vaccine, which is why we don't have it very often. So take the win, right? We know that COVID vaccine will protect you against COVID disease. It's still an open question about transmission. So until we get to that threshold of herd immunity, do all the things, wear the mask, do the physical distancing. Now the CDC has thrown everybody a bone here and said in the community, if you're around a group of friends and all of you are vaccinated, you don't have to wear a mask, right? That's a little bit of a win for us. But until we get to that point where we have large groups of people that are vaccinated, we all have to continue to do the stuff. And I hope I answered that question, Jean.
You did. Thank you so much. Okay, I know for those that have to jump off, and I also want to be respectful of your time, of course, I just want to jump to some of the questions that we just wanted to get some of your personal opinions, all three of you. So the first one that I am going to tackle that was one that came up more than once is that it has been reported that the medical community has had many opt out of being vaccinated. Is there an underlying reason? If so, why is this? And do you know what percentage of your staff have been vaccinated? So that's a very interesting and intriguing question.
Yeah, so I can start the conversation here and then let my colleagues here jump in. The interesting thing about the medical community and the concept of opting out, some of that may have come about at the very beginning because supply was so low compared to the demand. So as the vaccine was being rolled out to all of the states, those first couple of weeks, we certainly didn't get enough vaccine to be able to put shots in arms of everyone that wanted it. And so there may have been some of that concept of opting out, and which is not necessarily a true concept because there just wasn't enough vaccine. Now we got through that pretty quickly. And what we're starting to see now are individuals that are coming forward that were hesitant at the beginning to get the vaccine, but now are coming forward and saying, yes, you know, I was hesitant initially, I want to get the vaccine, and I'm ready for it. You also had, you have to remember, you know, we've been dealing with this since it's almost, I think it's been exactly a year since Michigan had its first known case. And, you know, at the early stages of this, we had a lot of healthcare workers that were, unfortunately, got sick themselves. And so a lot of those individuals have also been hesitant to get the vaccine. There wasn't enough good information early on to suggest that they would benefit from it. That information has come out in the last 3 months or so. And so you're starting to see a lot more of those individuals come forward. So I think this concept of opting out isn't necessarily 100% true. I'm sure there are some people that have opted out, but I think they're all getting lumped in together. Those individuals that were initially hesitant, those individuals that unfortunately had COVID in the medical community. But you're starting to see more and more individuals come forward now that did not get vaccinated early on, that are asking for it, that are part of the medical community, as well as you know, just more and more potentially peer pressure as well. Those individuals that did get vaccinated and see, look, nothing happened, and so you're going to start to see more of that as well. In terms of percentage, unfortunately, I don't have an exact number. I can tell you that everyone that wanted to get the vaccine has been able to get the vaccine within the McLaren Health System. We may just have a few random people that just for whatever reason, scheduling conflicts, just haven't been able to get it yet, but we actively work with those. And I'm sure that's pretty common across all the health systems in the state.
We're around approximately 65% vaccine uptake within Beaumont, which is eight hospitals. I can tell you that when we look at that breakdown a little bit more closely, frontline caregivers, nurses, physicians, that number is higher. You know, and we still are struggling with what I'll call sort of less patient-facing folks, more people that work in the offices and, you know, people behind the scenes. And the reasons are the same as the reasons in the community. People want to wait. They want to see if the data holds up. They want to, you know, they want to get a little bit more confidence. And I get it. Dr. Patel made a good point. We're not holding back. Anybody who wants the vaccine in our healthcare system can have access to it, and we continue to educate people to get it.
Yeah, I think you both you think you hit all the highlights of the discussion. We're about the same as you mentioned, Dr. Gilpin, at St. Joe's. We are. It is not required as we have with the flu vaccine for this year. But I will tell you that those that are at the front line were the very first ones to raise their hand to say, I'm interested. And those that weren't, and some, and I will just tell you, these are some anecdotal comments, but there were some, younger, healthier colleagues that said, there are patients who are out there that probably need it more than I do,
Yeah.
and wanted to make sure that when vaccine supplies are limited, that they want to sort of preserve it for those who are at higher risk than them. So we did see some of that happen, and I've got to tell you that our medical staff was outstanding in being sort of the model, with modeling behavior to say we're getting our vaccine because it's important, and understanding the science. That was a strong driving force for those that were maybe a little reluctant, and doing just a lot of education. I think just as with anyone else, even though we are all in the healthcare field, when there's science to be understood and interpreted and analyzed, we need a community of individuals to help with that, right? It's not just one person or a group of people. It's we're all supportive of one another. And then getting out into the community, I hope that this forum becomes an opportunity for those that might be a little reluctant to get the vaccine, to really consider it, really look at it and think about it, because it's not only protecting yourself, but it's also protecting everyone else around you. And so I really do appreciate this opportunity to be on this panel with my esteemed colleagues.
Well, thank you, Dr. Fergoli. And so I know that we are out of time, and we have probably another 4 hours worth of questions that have come in, but I wanted to give each of you an opportunity to make any final thoughts or comments before we jump off here. So I'll start with Dr. Gilpin.
Roll up your sleeve, get your vaccine as soon as you can. I really believe the only way we get through this pandemic is with a vaccine.
Thank you. Dr. Patel?
I'm going to say almost exactly the same thing. When it's your turn, roll up your sleeve, get the vaccine. Think not just of yourselves, but all of your family, friends, everyone around you. There are some individuals that are just not going to be able to get the vaccine. And this is our way to help protect them as well.
Thank you. And Dr. Fergoli?
Agree with my colleagues, but I will say that even though the numbers are down, and fortunately hospitalizations are down, mortality is down, deaths are down, the pandemic is not over, and that we still have, if we're at about 15% immunized to date, it may be a little higher than I didn't check today, but whatever that percentage is, until we can get to a point where most people are immunized, and as you've heard the term herd immunity or community immunity occurs, we have to keep our guard up, and that means all the protections and careful behaviors that we were taught from public health, that we continue to practice that on a daily basis.
Excellent. Thank you all. Thank you so much for your time and your commitment to the feedback and to our communities from a medical perspective. And I would also like to thank your colleagues who also behind the scenes helped us put this together from Beaumont, McLaren, and St. Joe. And then I also want to thank our colleagues from a chamber perspective, those from the Orion area, the Clarkston area, and the Auburn Hills Chamber. So thank you very much.